we're going to demonstrate how to do a 3-layer bandage for a wound. Depending on where the wound is, will determine how high up the bandage needs to go. If this wound, for example, were down distal to the carpus, I probably would choose to bring the bandage just above the joint above it, or just above the carpus. If the wound was somewhere in the forearm, I would again go one joint above and just above that, so in this case, I would go just above the elbow. I'm going to move this one distal to the carpus and demonstrate the shorter bandage, but you would do the entire one. So if this is the wound here, then we have some options for what to put on as a first layer. This is a Telfa pad, which is a non-adherent dressing. If I want the wound to heal and I feel like it's a clean wound, then I probably will just use this. On the other hand, if this is a dirty wound and it needs debridement, I may choose to use gauze 4x4s, potentially wetting them first. If I wet these and then put them on, it's called a wet to dry bandage, and what it does is when it dries into the wound. So what that means is when I rip this off, the top layer of that wound comes with it, so it's actually debrided part of the wound. If I have a wound that's already clean, I don't want to do this because it'll disrupt the healing of the wound in addition to being painful. In this case, my wound's healing pretty well, so I'm going to go ahead and just use the non-adherent dressing. From there, I can put a little bit of padding on it if I need to, or I can switch over to the conform gauze. In this case, because I'm going to bring the bandage up to here, I am going to put a little bit of padding before I put that layer of conform on, so that it's not directly on the skin. So I'm going to start distally, and I'm going to leave those 2 toes out if I can, depending on where the wound is. And I'd like to have those out if possible, so that I can continue to check on the bandage as far as whether there would be swelling or not. I mentioned going up above the next joint up, and that's what I'm going to do in this case. That way the bandage shouldn't slip down and expose the wound. Once I've put on a thin layer, what I need for protection of the wound, I put on my stretchy layer of conformer gauze over top of where the cast padding is, again leaving the feet or the toes out. This layer brings it a little bit more snug, provides a tiny bit of compression across the limb, and keeps the bandage hopefully from slipping down. The third layer of my bandage is going to be a vet wrap layer. I need to be careful not to pull this layer too tight. I don't want there to be like stretched areas in between this. The compression was added by this gauze and it's not added by the vet wrap. So I'm going to be very careful as I place it not to pull it tight. So I'm going to pull some off and then let it loosen before I take it around the limb. I'm going to cover up about 50%, so in other words, each little piece of the dog is covered by 2 pieces of vet wrap. I'm going to bring it up the limb to just below the top of the bandage. Once I've done that, I'm going to take a piece of white tape and label it with the date and my initials, and then put it on the patient so that we know when the bandage was done and by whom. If the patient were to go outside, they would need to cover this in order to keep it clean and dry.